Greetings.
Compartiendo.
Greetings. Now we are going to talk about our mini review, which is the topic rheumatoid arthritis. Our names are Mery Vargas Martinez and Velas.
Hi, good morning, teacher.
Our research question is, which is the best current management for the patients with rheumatoid arthritis, and if is it possible to establish a difference between the conventional treatment with methotrexate and the treatment with biological drugs? Our PICO question is, first, P, we have patients with a diagnosis of rheumatoid arthritis of 18 years. For the A, we have biological treatment on the intervention. On the control, we have, comparison, we have conventional management of rheumatoid arthritis with anti-rheumatic drugs and methotrexate. Our outcome is to establish a difference between mixed treatments for rheumatoid arthritis according to their efficacy about time. So our main objective is to establish which is the best treatment for rheumatoid arthritis according to its stages and its classification according to evidence found in databases in the period 2018 to 2023. Our keywords are rheumatoid arthritis, management, and biological drugs. Our evidence bases are PubMed, Google Scholar, Lilacs, and Elsevier. Methodology is to research on evidence bases like the ones that we talked about before, like PubMed, Google Scholar, Elsevier, Lilacs, with the criteria of rheumatoid arthritis and methotrexate and biological treatment. We research on databases with a range of time of 5 years to 2018 to 2023. Our inclusion criteria were patients with RA over 18 years, and our exclusion criteria were patients with juvenile arthritis, refractory arthritis, and psoriatic arthritis.
Okay. So, as for rheumatoid arthritis is a disease that has afflicted the world. A prevalence of 5 cases per 1,000 adults. This pathology affects women 2 to 3 times more frequently with age incides in patients in the disease rheumatoid arthritis pathology consists of chronic inflammation of the synaptic membranes, which can destroy the joint, articular bone, and articular cartilage. Anti-rheumatoid medication control the pathology, but thanks to evidence-based medicine and the increases in science, it is now possible to discover the biological paths with respective molecules in which the biological drug treatment can be applied. Through this collections analysis found that the importance of biological risk for rheumatoid arthritis is really mini review says to highlight the cooperation between synthesis and biological drugs resulting in the improvement of patients who adapt to treatment to accompany with sport activities as ordered by a sport doctor. And next. And diagnosis of the rheumatoid arthritis, diagnosis criteria, responses, um, observe of one articular affected, two dread, articulants affect bit, one treat, articulates small affect, sorry, small affect small. Four, 10 articulates affect small. So terminology reads as negative in others. Next.
Now, to evaluate the rheumatoid arthritis, we have the rapid 3 score. This survey takes that if you are able to first dress yourself, getting out of bed, lead a full cup or glass to your mouth, walk outdoors on flat ground, wash and dry, bend down to pick up clothing from the floor, turn faucets on and off, get in and out of a car, walk 2 miles or 3 kilometers if you wish, or participate in recreational activities as sports as you would like, if you wish. All of these questions will give us a score that we have here. But first, we have two more questions. First is the pain assessment, is how much pain have you had because of your condition over the past week? It is to 0 from to 10. And the personal assessment, considering all the ways in which illness and health conditions may affect you all this time, please indicate below how you are doing. It is to 0, from 0 to 10. Our score ranges are 1 to 3, near remission, pathology, 4 to 6, low severity, 7 to 12, moderate severity, and 13 to 30, high severity.
Now, definition rheumatoid arthritis is type of the pathology and synovitis, joint inflammation, tooth, synovial hypertrophy, cartilage erosion, treat joint deformity, inflammation, on erosion, for advanced cartilage and bony dance and icon loss. Epidemiology are rheumatoid arthritis is the most common autoimmune disease in adults. Worldwide, it was the prevalence was between 0.5 and 1%. Being more common in women than in men, and with a peak percentage between 16 and 64 years of age. Etiology, a result of the interaction of trading action and predisposition, genetic basis, differential diagnosis, synovitis. Next. Diagnosis or not, individual of collection treatment are rheumatoid and biological drugs, complication, pulmonary arteries, sarcopenia, osteoporosis, prognosis. It depends of the treatment. It differs to years and the evolution of the pathology. Prevention, reduce episodes of stress and adult psychological activity. What do we know about the treatment? See figurines products are made to raise and sustain the treatment to again rheumatoid arthritis. Standard strike, alternative strike, results of action. First line treatment, second treatment, third line treatment, raise immune, please. observation and after comparison in diagnosis. Well, scientists and biology and classification, originator biology, um, originator biology, um, tooth granted appropriate disease modification altitude drugs, United States, Europe, or both. Scientists dart molecular star structures selected as advanced. Okay, next.
Okay, next we have the treatment response to different scheme of treatment in the RA. We have first that in the mini review we did, we have a comparison between treatment response for the different therapies and different schemes that they used in the rheumatoid arthritis with different types of patients. So in this study, we have a very significant, very significant graphic that show us first the biological DMARDs and the target synthetic DMARDs. We have a comparison between methotrexate monotherapy and the methotrexate combined with other DMARD, which is biological. So we have baricitinib, abacetep, all these biological drugs, we have a comparison between them. So the main adverse effects on the management of the RA are we have first the methotrexate. We have a very high toxicity in the respiratory system, in the gastroenterological system. These drugs have a high rate of toxicity in almost every system. The biological DMARDs are also with a very high toxicity in almost every system because these drugs are combined and it increases the prevalence of present and adverse reaction to the drugs. So the data analysis, we have the treatment, a comparison with the treatment with the active conventional treatment, cetuximab and methotrexate, abatacept and methotrexate, and tocilizumab and methotrexate. We have it have a race difference between 95% and we have conclusions that it had a high CDAI remission rate. So the conclusions are, first, high remission rates were found in disease-modifying anti-rheumatic drug-naive patients with early rheumatoid arthritis who start treatment with methotrexate in combination with the biological DMARDs like abatacept and certolizumab. Two, it was observed higher CDIA remission rates for abatacept versus active conventional treatment. So we thought that is more effective in some cases that we use only methotrexate, which is an active conventional treatment, except for other therapies or other schemes which with biological drugs.
Three, the similarity of responsible rates to the various targeted therapies meet the bit, explaining bit at common patriot targeted disease that works. For early diagnosis of rheumatoid arthritis allows clinics to boldly prescribe methotrexate as the diagnose airway disease in a larger proportion of patients. It's important say the biologist is company the methotrexate for patient beds.
This is our reference. These are our references, and that is all. Thank you so much.
Thank you.